Hi everyone. Today we are from the SGD Group B10, and today we are going to talk about the clinical use of systemic antifungal drugs. Enjoy. So here are our members.
Hello, my name is Bagus Gede Kinandanamas Manuaba, with student number of 2002511210.
Hello, my name is Dewa Sari. This is the number of 2002511211.
Hello, my name is Gusti Ngurah Tata Adityawarnam with the student number of 2002511215.
Hello, my name is Kurniati Atmaja with student number of 2002511216.
My name is Bagus Agung Suputra and Nugraha Negara with student number of 20025111219.
Hello, my name is Maharany with student number 200251120.
Hello, my name is Putu Sharita Partiwi with student number 20025112221.
Hi, my name is Tasya with student number of 20025112227.
Hi, my name is Joshua Francisco Sofian with the student number of 20025112229.
Hello, my name is Krisanta Aldramitrajo with the student number of 20025111230.
Hello, my name is Timothy Julian and my student number is 20025112233. Next.
Hello, my name is Arya Clara Budiman and my student number is 20025112234.
Hello, my name is Amanda Raisa Suryananda with a student number of 20025111237.
All right, now that we've all introduced ourselves, moving on.
So invasive fungal infections are of much greater concern as its mortality rate often exceeds 50% and killing approximately 1.5 million people each year. They are categorized as one of the most difficult diseases to manage in humans. Fungi have many varieties of abilities that are disadvantageous to human beings. A common treatment for fungal infections is using an antifungal agent, which is a drug that selectively destroys pathogens with minimal side effects to the host. The treatment period depends on the diversity of the chronic level of fungal diseases. Next.
So, what is a fungal disease? A fungal disease is an illness which are caused by fungi, a non-autotrophic protists which grow interlacing filaments that are called mycelium. And what are the problem formulation for this student project? First, what are systemic antifungal drugs? Second, what is the mechanism of the systemic antifungal drugs? Third, what are the clinical use of systemic antifungal drugs? And fourth, what are the problems that may arise through using systemic antifungal drugs?
All right, so here are objectives for this presentation. For the purpose of writing this literature review is to increase knowledge on systemic antifungal drugs, general definition, mechanism, clinical uses, and several problems on using them. For the readers, we hope that they are able to increase knowledge on what systemic antifungal drugs are and its uses. And for us, the writers, we hope to gain knowledge through researching and reading journals, as well as develop skills to work together in a team. Moving on.
So I will explain about the definition of systemic antifungal drugs. Systemic antifungal drugs are defined as drugs that are used to treat patients with systemic fungal infection and other high-risk patients. Systemic antifungal drugs are further classified into 5 classes, which are polyenes, imidazole, azole, echinocandins, and fluxitocin. They have been shown to have interaction with plentiful drugs. From there, those systemic antifungal drugs were classified into 2 categories: drugs that are involved in the pharmacokinetic interactions and drugs which are the results of pharmacodynamic interactions. Next slide.
Okay, so I'm going to explain about the mechanism of systemic antifungal drugs. The main mechanism of activity for antifungal drug antifungal drug includes disturbance of spindle and cytoplasmic microtubule work, consumption of ergosterol along with the binding of squalene. Ergosterol is a sterile component that is mainly active on the cell layers of growth and acts to keep up cell film uprightness. Meanwhile, pollens such as amphotericin B, niacin, and natamycin are most frequently used in antifungal therapy. Without the defensive layer of ergosterol, the cell film get porous, releasing intracellular substance.
I want to continue my friend's explanation. So currently, there are 4 models of the pollen mode of antifungal action have been proposed. The first one is the pore-forming model, the second one is the surface absorption model, the third one is the sterile spawn model, and the last one is the oxidative damage model. In each of these models, it is shown that the binding for pollen with ergosterol significantly impact the antifungal effect because ergosterol plays an important role in many cellular processes of fungi. On the other hand, the function of squalene would be creating a lack of ergosterol. Besides, it has extra antifungal movement since it represents squalene epoxidase and overall cause intracellular aggregation of squalene. On another note, most of these components notably impact the clinical adequacy of antifungal specialized. Next.
So there are systemic antifungal drugs, and there are several other clinical uses. So the first one is the pollen groups. It is made of amphotericin and nystatin, and it is not absorbed orally, and it is used for oral or pharyngeal and perioral injections administered in the mouth. Next.
So next I'll be talking about the imidazole group. So the first one I'll be explaining about what is the drugs that is contained in the imidazole group. So the first one, it is imidazole, clotrimazole, ketoconazole, econazole, sulfazole, and the last one is ioconazole. And it is used for local therapy or vaginal candidiasis and dermatophyte infections.
The next one is azole antifungal, and the clinical use is azole block as ergosterol synthesis, and also given orally to treat chronic mycosis. Next, the next one is echinocandin. The clinical use is to stop glucan synthesis, target fungal cell walls, for example, anidulan fungin, caspofungin, and micafungin. Okay.
All right, next up we have flucytosine. These drugs are prone to resistance, making them be used alongside other drugs. Flucytosine and amphotericin B combination is used as cryptococcosis treatment, but it can also be used for disseminated candidiasis, including endocarditis, and then other yeast infections and severe invasive aspergillosis. Flucytosine and antifungal azole combination are used for treating cryptococcal meningitis. However, there are several side effects of this drug, which include bone marrow suppression, which is a thrombocytopenia and leukopenia, and then hepatotoxicity, and then enterocolitis.
Problem of systemic antifungal drugs usage. This may cause antifungal resistance, which limits medication choices, thus create a limit on medication choices as it could render to be completely useless. This may be because by patients failed or no response toward the antifungal drugs in adequate doses and patient being immunocompromised.
The drug resistance is classified into two types, which are primary and secondary. Primary drug resistance is found naturally in several fungi. Nowadays, antifungal drug resistance could potentially develop into secondary drug resistance, which has been exposed to medication. Although the prevalence of antifungal drug resistance is not as huge as the bacteria resistant towards antibiotic, medication choice towards fungal infection are very limited.
So the conclusion of our presentation is systemic antifungal drugs are used to treat patients with systemic antifungal infection. This drug mean used to kill and prevent growth of fungal cells. This drug classified to 5 groups, each with its own clinical use is polyene, imidazole, azole, echinocandins, and flucytosine. Systemic antifungal drugs used may cause resistance due to several factors.
All right, so here are the references that are used in the making of this literature review.
All right, so that is it from us. Thank you so much for watching and see you on the next video.